Rapidly increasing rates of supplement-induced liver failure are prompting more doctors to warn about the serious health risks of this largely unregulated billion-dollar industry. Now, despite the lack of oversight from the FDA, experts say the popularity of herbal supplements and vitamins is still soaring. NBC News correspondent Emily Ikeda looks into which ones could actually be the most harmful.
When Robert Grafton turned 50, the father of 5 started prioritizing his health, eating better, exercising more.
Then I started seeing ads for different supplements, and I said, why not? I'll start trying them.
He's far from alone. 3/4 of adults in the U.S. use supplements, according to an industry trade group. But within a week of adding a liquid turmeric combo to his supplement routine, Grafton fell extremely ill.
I couldn't stand the look of food. I felt nauseous. I started itching.
Dr. Dina Halegua DiMarzio is a hepatologist at Jefferson Health in Philadelphia and showed us his blood work.
So you can see that, it's over 10 times the upper limit of normal.
Grafton had a supplement-induced liver injury.
Are you seeing people increasingly take supplements?
Yes, it's become a billion-dollar industry. And we've seen that trend mirror in terms of liver injury from supplements.
One study found serious liver failure cases related to supplements increased 8-fold between 1995 and 2020, though still rare. Experts say consumers should be especially mindful of botanical supplements, which aren't as well studied. Turmeric, green tea extract, and ashwagandha are among the most popular that can lead to liver damage.
When you hear herbal or natural, it sounds like something good for you, but that's not always the case.
Yes, natural does not mean safe. There's a difference between cooking with a spice like turmeric or drinking green tea. But then when you take that compound and you concentrate it and add other potential chemicals to put it into a tablet, this is where things can really go wrong.
Unlike medications, the FDA does not vet supplements for safety or effectiveness before they hit store shelves. It's why Grafton, who has made a full recovery, says he's gone back to the basics.
I try to exercise every day, eat as healthy as I can.
Keeping it simple.
Keeping it simple.
Emily Ikeda, NBC News.
Keeping it simple. Joining us now to help us keep it simple. More on this, Dr. Bayo Curry-Winchell. Dr. Bayo, Robert Grafton's story there. I mean, it's just one of many that doctors are seeing popping up more and more. Taking too much of one supplement can cause what's called toxic hepatitis. But what exactly does that mean?
Let's break that down. Hepatitis, anytime you see the word itis, that means inflammation. And so the liver has become inflamed. And the liver's job is to filter out toxins or harmful products. And when it's become overburdened or over supplemented with what happened with Robert, it can lead to damage and serious health conditions.
Well, then I guess my question is, if we're worried about inflammation, if the itis, as you say, is the concern, how do we check? Like, how do we know if the specific supplement we're taking is actually safe?
It can be really tough. Natural doesn't naturally mean safe. And so really leaning into resources such as LiverTox. It's a source that I use as a doctor to really check medicines and supplements to make sure that they're going to be safe in my patient, because currently supplements and vitamins are not regulated by the FDA. And therefore, any label could be put on a product and you may not know what you're putting into your body could actually be causing more harm than good.
You repeat that resource that you just named. Was it a website, Dr. BCW?
Yes, it's called LiverTox. It's a great resource. And so you can put in products such as Tylenol or, such as turmeric, different supplements and vitamins and medicines. And it allows you to know more about that product before you ingest it. And I can't not forget, it's important to have a conversation with your doctor as well.
That is a good point. And I know we're not talking about medicines, we're talking about, supplements, but is the dosage also important in that case?
It is, because we naturally make certain vitamins in our body. And so whatever you're taking in could be too much or could actually have something separate. And so you really want to make sure that the dosing is correct for you. And I always like to say we're individuals, so we want to make sure that we have the right choice. So have that conversation with your doctor.
Dr. Bayo Curry-Winchell, thank you so much for your time and your expertise. We appreciate it.